We actually fall from 13,000 feet. Well, actually, my bucket list was to be with my husband, things that we had planned. And then he was diagnosed in 2000. So he had to be eventually put into a home, but that meant that I was alone. I think one of the first things was a hot air balloon ride. And then I took one of my kids and his 4 children. We went ziplining in Anderson. Hey, Nana, would you ever go on a skydive? I said, Gabe, if you go with me. And so that started our first skydive. I've gone 5 times, and we have another one planned in the spring. It was terror. It was terror because it was so bad, and it came on gradually. It was actually between 2 of my yearly checkups. The whole thing evolved, and it got to be so bad I could hardly walk, and I was walking with a cane.
So I've known Donna Mae now for a couple of years. I actually took care of her right hip in a different scenario. And when her left hip started hurting, she knew who to come see. And so her family brought her in. We started talking about options and eventually got the hip replacement. Kind of jokingly, she goes, well, if I have a hip replacement, I can't wear a bikini, can I? And I surprised her back. I said, well, actually, you might be able to. There are a lot of ways to do a hip replacement, and specifically to get into the hip. One of those is the bikini incision. And so instead of going on a longitudinal plane or going straight down the leg or on the side of the hip, I can basically go in what are called Langer's lines, so more cosmetic appearance so that you don't see the scar.
I didn't want a ton of scarring, and so I just made a candid, just an off-the-cuff mark. Well, I can't wear my bikini anymore. And he said, well, we're doing a bikini cut.
Surface, and then this goes on the inside of the bone. There's a lot of ways to do a hip replacement. One of the reasons that I like to do the anterior approach is I really don't cut any of the muscles. So basically, I'm just moving one muscle out of the way, and then I'm looking at the hip joint, and I'm allowing that muscle to come right back where it was. And that less muscle disruption should hopefully speed up recovery.
I think he's absolutely on the cutting edge of what he's doing. I really do. He communicates with the family well. He communicates with the patient. He's open to questions, and he explains things well. Besides that, he remembers you.
I took a look back at the x-rays again. The reaction from patients to the bikini incision has been a lot of fun so far. It's not for everyone. Just like hip replacement isn't for everyone. What you'll find when you're in my office is we spend a lot of time talking. And I think that's okay, because we need to be on the same page. The priority is that patient's hip or knee. And as long as we're on the same team, then we're going to know that the right surgical approach is individualized for each patient.
I do have some stiffness, which Dr. Bowler said will take about a year to get over. And so I use my cane for balance, but I'm doing my exercises and stretching, and life is a pleasure, life is full.